Hello, Mark Campion, HMI with Estyn here. I'm delighted to join you today. My presentation is called Mirrors and Smoke, and I'll explain why at the end. I'm going to cover three interrelated areas with you today: using SHRN data to support improvement in your school, developing a whole school approach that supports people's health and well-being, and finally, preparing for curriculum for Wales. Using SHRN data to support school improvement. There are two surveys, most commonly known that the general public are all aware of, and people who work in schools and with children and people in schools and other agencies, is the Student Health and Wellbeing Survey. Over 100,000 pupils took part in the last survey, making it the largest survey of young people in Wales. Hopefully you've had the report for your school from last time and you've already been using that information to inform your school improvement work. I'm not going to focus on the student survey today. I'm going to focus on the other survey that's part of the network, and that's the school environment questionnaire. Now, not everybody took part in that, so 167 of the 213 schools in the SHRN network completed that survey, although some of those schools only partly completed it for whatever reason. Maybe they didn't have all the answers and it was a battle against time to get it completed. But I'm going to focus on the outcomes of that particular survey and look at how we can use that to help our school improvement work. Now, I'm just going to pull out some of the results that I found interesting when I had a look at the national report based on the school environment questionnaire, starting with question 12, which asks about who in the school is using the health and well-being data that's available. That would include the student survey, of course, and you can see on the screen the responses from secondary schools around Wales about who is using that information. And I think there's a challenge there. Our Healthy and Happy report in 2019 highlighted how critically important it was that the school leaders right to the very top both talked about people's health and well-being and walked the talk in the way that they interacted with their staff, with pupils, parents, and the wider community. While it comes from the very top, it needs to be a shared vision and a shared understanding involving the governing body, other leaders, and all members of staff if we are to successfully work together in the school to support pupils. It's very important that pupils themselves are involved in the conversation about what schools do with their health and well-being data. Only 60% of schools said they involve students in any way, which is often just through the school council. I think it's really important that pupils are all involved in these discussions. It makes a difference to their sense of belonging and value in the school, the extent to which they feel part of these discussions, that their views matter, that staff really care about them and want to understand what's going on. We know how critically important parents are in the health and well-being of children and young people, and yet just 11% of secondary schools are satisfied with the level of parent involvement in health and well-being improvement work. So we need to find creative, innovative ways to bring parents into the conversation about how we support health and well-being of pupils in secondary schools. Covered who uses the health and well-being data for your school, but I'd just like at this point to reference the wider evaluation and improvement work of schools and make sure you're aware on Hub of the developing national evaluation and improvement resource, which will provide schools with a range of principles and approaches, as well as practical case studies and resources to support effective evaluation. It's not about prescribing a particular approach, and you should use the resource to develop your own approach to self-evaluation, but there are tools and approaches there that you can adapt and use in your own context. It has links to curriculum development, pedagogy, professional learning, the well-being of learners and staff, and schools as learning organisations. So I highly recommend you take a look at that to support your work in evaluating and improving the health and well-being of learners. Let's now turn to look at developing a whole school approach to health and well-being. Our Healthy and Happy report highlighted the importance of a whole school approach to supporting pupils' health and well-being and the challenge in doing so in secondary schools. I'm going to use the school environment questionnaire findings to highlight some of the aspects you might want to look at closely in your own school. Questions 56 and 57 in the school environment questionnaire ask about the dining environment and the length of the lunch break, as you can see some of the findings here on screen. You can see what we had to say about lunch breaks in our Healthy and Happy report on screen there. We teach lessons about healthy eating in schools, but does the way we run our schools support a healthy lifestyle or make it a less attractive option? While 6% of secondary schools said they'd increased their lunchtime in the last 2 years, remember this was prior to the pandemic, 22% had actually reduced it, and a further 22% had said they'd considered reducing it. And we know that changes have been forced upon schools through this pandemic period, and I'm sure it's something that you're discussing in management meetings in schools at the moment about what sort of lunch break, what sort of mid-morning break do you want in your school, and what effect does your choice have on the physical and mental health of the learners. Question 15 of the school environment questionnaire asked about restorative practices. And whilst it's pleasing to see most secondary schools use restorative practices, often this is only to a certain extent or in certain situations. Our Healthy and Happy report found that policies around restorative practice mean little to pupils unless staff apply those approaches when working with them consistently. Question 88 of the school environment questionnaire covered sexual health drop-in services, and it's great to see that many schools in Wales offer such a service, even if it's usually through the school nurse and not necessarily widely promoted within the school community. Our Healthy and Happy report noted how important such services are and really make a difference to supporting better behaviours amongst young people, and certainly not harmful behaviours as some people might fear. If you're not a school that currently provides a service, or maybe you don't widely promote it, then there's something to think about. So with just over a year to go until we're rolling out Curriculum for Wales for Year 7 in our schools in Wales, I just want to turn our thoughts to how we might use the next year to prepare as best we can for good learning experiences in health and well-being. As you know, a lot of health and well-being is currently delivered through PSE within the curriculum. And question 28 of the school environment questionnaire asks schools about their arrangements for the delivery of PSE. And I've just put some highlights on screen there, along with our findings from Healthy and Happy, which noted that really the best approach, the most effective approach, was one that is a blended mix of regular lessons taught by staff who teach the subject effectively, special PSE events, and strong support across the curriculum. It is concerning that currently only half of pupils in Year 7 have regular timetabled PSE lessons, and less than a third by the time we get to Year 10. We know how valuable regular opportunities to consolidate learning in this area are for pupils, and I think this is a really challenging point for secondary schools in looking to Curriculum for Wales and how best to deliver a health and well-being curriculum that meets the needs of learners and is actually impactful. Question 31 of the school environment questionnaire asked about who is teaching PSE currently, and you can see the results there on screen. I think it's really important that we don't just focus on having regular lessons on in schools, but thinking about who is teaching those lessons and how well prepared they are to deliver those lessons effectively. While external contributors have a really important part to play in supporting the work on health and well-being in secondary schools, it's really important that pupils don't see that you're parking this with external people, that actually it's an important part of what the school sees itself as there to support pupils with. So external contributions work best when they add value to core learning experiences provided by pupils' usual teachers. On the last slide, we saw the results from the school environment questionnaire that showed that it's mostly form tutors or any teacher in the school that is currently delivering PSE. What the survey also found under question 32 was that these teachers do not receive enough training. In fact, more than half of them have had no training to deliver health and well-being learning experiences. Our Healthy and Happy report noted these issues around the professional development of teachers in this area. And with Curriculum for Wales on the horizon, this is absolutely an area that secondary schools will need to focus on very carefully. We thought about how much time do we give to PSE currently. We've looked at who teaches PSE currently. And I just want to highlight one other point from our Healthy and Happy report. That was about schools not drawing enough on research findings about effective pedagogies or approaches to supporting pupils in this area. We need to question, how do we teach health and well-being? What approaches are proven to make a difference in pupils' behaviours, in their attitudes, in their lifestyles? We do have a unique opportunity with Curriculum for Wales to refresh our approach to this area of the curriculum in secondary schools. Aside from PSE, PE is of course a very important part of the current curriculum that supports pupils' health and well-being. Unlike PSE, the quality of PE in secondary schools is generally better than that in primary schools. Question 33 of the school environment questionnaire asks schools about how much time they're currently giving to PE, and I've put a brief summary on the slide here. Schools need to answer important questions going forward about how much time they want to devote to physical activity within their Curriculum for Wales offer. Also, as our Healthy and Happy report highlighted, schools need to discuss the nature of physical activity with pupils in order to maximise their motivation and participation, and therefore realise the health benefits of taking part. As you reflect on how you use data about health and well-being in your school, you think about the extent to which you have a whole school approach, and as you plan for Curriculum for Wales, you may find it helpful to revisit these various thematic reports that we published in recent years that I think provide really helpful guidance and support, and also offer case studies of effective practice in a range of areas related to learners' health and well-being. As we draw to a conclusion, I hope I've made you itch and scratch and think, just using snippets of information from the school environment questionnaire that got me thinking about how we currently run our secondary schools in Wales. Smoke and mirrors is an expression we use in relation to covering things up or diverting attention from what's really there. In relation to pupils' health and well-being, of course, we want and need to be doing quite the opposite. You have a lot of information about your pupils and about how you currently support them in your school, and we need to use this information to challenge ourselves to further improve. Schools need to hold a mirror up to themselves and examine closely what they see in terms of pupils' health and well-being. And schools need to watch for smoke. As another expression goes, there's no smoke without fire, So if we see smoke, we need to work out what's causing it. In summary, the route to improvements in pupils' health and well-being starts by carefully analysing what's happening in the school and what pupils themselves are telling us. We can then work with pupils, their parents, staff and partner agencies to address the areas for improvement, whether these relate to the whole school, specific groups of pupils, or just one individual. Prevention is better than cure. So using the information we have when preparing for Curriculum for Wales is essential if we are to make the most of the opportunity that curriculum reform brings. I encourage you to be bold and to be brave in developing a fresh approach to the secondary school experience that truly does deliver on the 4 purposes. I wish you the very best. Thank you.